Welcome, everybody. On behalf of the Center for Occupational and Environmental Health, I'd like to welcome you to this webinar in our 2017 series on the topic Mindfulness, Promoting Health and Safety by Being in the Moment, presented today by Dr. Jessica Drew de Paz, who's a research scientist at UC Irvine. Before we get started, I'd like to just go over a few housekeeping items. First of all, you'll all be muted during this presentation. So if you'd like to ask a question or make a comment, please enter it into the online Q&A that you will see on your screen. At the end of the presentation, we'll spend 5 to 10 minutes in a Q&A session with Dr. Drew de Paz. For those who are interested, one continuing education contact hour is available for this webinar, and if you wish to obtain CE credit, please register again at coehce.org. You will have to pay a $30 fee for that and complete an evaluation, and you'll then be emailed your certificate of completion. After today, the webinar will be archived and a link is provided available for CE credit only. We're also currently live streaming on Facebook for those who are interested to view that way. Our monthly webinar series takes place on the first Wednesday of each month at 10:30 a.m. and next month on Wednesday, November 1st at 10:30 a.m. we're pleased to have Richard Meyer, who is an industrial hygienist and who spent many years working for OSHA, presenting on the process safety pyramid, which is a tool for understanding the fundamentals of chemical process safety. So thank you, everybody. At this point, I'd like to introduce our speaker today. Dr. Jessica Drew de Paz is a clinical psychologist with a background in mindfulness. Jessica has 20 years of experience within the University of California system, where she's rendered psychological services, led diversity efforts, and overseen health and safety training. Currently, Jessica serves on the UC Risk and Safety Training Team and leads the UC Mindful Health and Safety Center. In collaboration with UC Irvine's Environmental Health and Safety Risk Services Department and the UC Irvine Susan Samueli Center for Integrative Medicine, she's investigating the potential for a mindful health and safety program to improve workplace health and safety outcomes. We're very pleased to welcome Dr. Drew de Paz this morning. Thank you. I'm going to hand over to you now.
Great, thank you so much. Before I get started, I do have one square or rectangle in the middle of my PowerPoint screen that says, please move this window away from the shared. And I don't know if that's affecting anyone's view of my slides.
To me, your slide looks perfectly I just see your slide, your PowerPoint. But if anyone has a problem, please enter it into the Q&A and let us know.
Okay, great. When I tried to move it, it advanced my slides. So I will just let it be there and hope it's not blocking anyone's view. I'd like to thank the UC Berkeley Center for Occupational and Environmental Health for hosting this talk. And thanks to all of you for joining me to hear about mindfulness, which is my favorite subject, and also how we can use it to promote health and safety by being in the moment. So today we'll be talking about root causes of injuries, one in particular. It wouldn't be a proper mindfulness talk without doing an experiential exercise. So I will be incorporating that for those of you who would like to join me. I'll be covering an overview of mindfulness research and then talking about the efforts from the UC Mindful Health and Safety Center. So I'll start with a bit of background on the organization I'm from, which is the University of California. As many of you may know, the UC system consists of 10 campuses, 5 medical centers, and we're affiliated with 3 national laboratories. It includes more than 233,000 students and over 190,000 employees. And as Julia mentioned, I have 2 roles within the UC system, both of which connect to the Office of the President, which are the system-wide headquarters. I'm a member of the UC Risk and Safety team, and we develop system-wide training focused on risk and safety. And in addition, I lead the UC Mindful Health and Safety Center, which began with a sponsorship from UCOP's Office of Risk Services. So this presentation will focus on the conception, the background, and the work stemming from the Mindful Health and Safety Center. I wanted to first share a story about how the center came about. And I think an important part of the story pertains to the fact that I work in 2 fields. I'm a clinical psychologist by training with several years experience at university counseling centers. But about a decade ago, I veered off my career path and accepted a position at UC Irvine's Environmental Health and Safety Department, overseeing the campus health and safety training. During that time, I had a small private practice as a psychologist where I was integrating mindfulness techniques with my clients. And I did, and I still do, teach mindfulness to elementary school students. So essentially, I've often felt as though I was wearing a psychology hat and a safety hat. And I'll get into that more in a bit. But to talk a little bit about the safety hat, many organizations, as you may know, have environmental health and safety departments, whose general purpose is to protect people, property, and the environment. And I just thought I'd show kind of an annual cost of injuries and illnesses put out by the Economic Policy Institute, basically showing that nationwide we spend about $250 billion. Much of that is associated with medical costs, but also the medical costs are actually exceeded by productivity costs. And, these costs don't in any way account for the pain and suffering caused by this heavy toll of injury and illness on the individuals as well as their families. So there are many ways in which environmental health and safety departments attempt to reduce injuries in the workplace. And often this involves an investigation of what is causing the accidents in the first place. So several years ago at UC Irvine, the EH&S staff were examining data on our own employee injuries. And this particular graph is what we were looking at. It depicts about 420 accidents. And as you can see, from the root cause analysis, the finding was that distraction and inattention was the primary role in the injuries that we were seeing at UC Irvine. I just wanted to add another piece onto this, and that is that distraction also plays a key role in preventable hospital errors. And hospital medical errors are the 3rd leading cause of death in the United States. So if we were in person, I would get some discussion going, but online, I just want you to kind of think for a moment, is inattention, distraction, a safety hazard at your organization? Do you believe that it is? And if so, how are you addressing it? So I think traditionally the way that we address safety is through trainings. Often trainings are very technical in nature. So we teach things such as how to extinguish fires and how to drive motorized carts. It's very important material, but the issue of attention is rarely addressed. I've sat through all of the safety trainings offered at UC Irvine, and at the most, if attention is addressed, it might just be a warning for something extremely hazardous, perhaps like a laser. Someone might say this, be very, very careful and pay close attention when using this laser because it might put your eye out. And that's about how far we teach attention. But telling someone to pay attention and teaching them how to do so are entirely different experiences. So as I sat there in that meeting contemplating the fact that inattention and distraction are root causes of injuries, it occurred to me that we, not only UCI, but the entire UC system, because I'm on work groups across the UC system, that we are not adequately addressing the problem. And pulling from my psychology background, it dawned on me that a solution to this safety problem would be to implement mindfulness training, which is a highly effective program that's gaining huge momentum throughout the fields of psychology and medicine. And a key ingredient to mention here is that mindfulness training, one very important aspect of it is that it is attention training. It's many other things, but it is attention training. So a little bit about mindfulness, which really, has been practiced around the world for thousands of years. And it's affiliated with most major religions and many different cultures. But it was largely brought into mainstream Western culture. There are many key people who have worked to do this. And one is Dr. John Kabat-Zinn, who's pictured here. He's a molecular biologist from MIT. And in the 70s, he worked as a professor of medicine at the University of Massachusetts Medical School. And he was deeply concerned with what he referred to as the full catastrophe that many people are facing as they face their own stress, pain, and illness. But really, even if someone is not sick, life is full of catastrophes and suffering and pain, and we all face full catastrophe at some point in our lives, or perhaps many points in our lives. And Dr. John Kabat-Zinn he practiced meditation on his own and found the benefits to be so incredible in his own life that he wanted to bring this to people in the hospital. And he decided that he would first develop a program for people who were in chronic pain. So he asked people at the hospital to send him people who really had all the surgeries they could have, all the medicine they could have, and that, they just weren't getting better. And the hospital sent him a lot of people, and many of whom reported feeling much better after learning mindfulness. And they reduced the medications that they were taking, and they reported significant benefits. And what happened here is that this was really the start of the research, and which has completely taken off, and I'll get into that in a bit. But let me first take a moment and have John Kabat-Zinn, in his own words, describe what mindfulness is.
My working definition of mindfulness is that it's the awareness that arises through paying attention on purpose in the present moment and non-judgmentally. So it's awareness, and the awareness is cultivated by paying attention. And in a particular way, on purpose, in other words, intentionally, in the present moment, which is the only moment we ever have to be alive in. And then, most challenging of all, non-judgmentally. And that means, of course, we have judgments about everything, but to not be caught in those judgments so that we color everything through our likes and dislikes. So that sounds pretty simple. Okay, paying attention, I can do that. But actually, when you start to pay attention to how much we pay attention, a lot of the time our minds are all over the place, and we have a very hard time sustaining attention. And our attention is not very vivid, and it's not very stable. And teachers go out of their minds screaming and yelling at their classes of students, pay attention, pay attention, pay attention. But nobody learns to pay attention by being screamed at to pay attention. So, but it's something that we can teach people how to pay attention. And it's very, very powerful to learn how to sustain attention moment by moment by moment by moment.
So I'd like to share a brief example of a mindfulness exercise and invite you to participate if you'd like. Often our bodies arrive places long before our minds do. So even though you are sitting or standing in the space that you're in and that your bodies are there physically, our minds can be anywhere. And they might be thinking about a previous conversation that you had before this webinar began, or perhaps you're wondering where you're going to go for lunch, or a meeting you'll be joining later today. But our senses are a gateway into the present moment, and we can use these to bring ourselves more fully into this moment. So I'd like to ask you to begin with your sense of sight and just invite you to look around whatever space that you happen to be in and notice what you see. Perhaps you're noticing the room setup, the furniture, the lighting. Maybe there's people nearby. One aspect of mindfulness is also noticing without judgment. So just noticing what is. And now I'd like to invite you to close your eyes if you like, or take a soft gaze, and notice what you hear. You might notice sounds that are close by. You might notice sounds from outside of the room that you're in. You might even notice the sound of silence. And now shift your attention to your body and just noticing how your body feels. Perhaps you're sitting in a seat. You might notice the points of contact that your body is making with the chair. Perhaps you feel your feet on the floor or the air on your skin. And finally, take a few moments to notice the sensations of your breath. Just noticing the air as it enters your nose or your mouth. Noticing any movements in your body as you breathe. And noticing the sensations as you exhale. You might find as you try to focus on your breath that your mind drifts to other topics, other noises, other thoughts. And if so, that's perfectly normal. Just gently try to escort your attention back to your breath. So I'd like to thank you for engaging in this exercise and using your senses to bring yourself more fully into this moment. Since we aren't able to debrief about it in person, if you have any comments about what you experienced during this, feel free to write it in, and Julia might have time to share at the very end. So John Kabat-Zinn, the program he developed is called Mindfulness-Based Stress Reduction, or MBSR, and it's an 8-week program that people meet for about 2 hours a week in person, and there's also a 6-hour silent retreat typically involved with this. And just to try to share a little bit about what happens if you haven't been involved with one of these trainings, people learn formal mindfulness practices. So we just walked through a very brief kind of formal time that we set aside to try to focus our attention on different things. So sometimes, though, people might focus on what's called the body scan. So kind of doing a walkthrough of one's whole body and noticing sensations in the body and noticing that your mind drifts off and bringing it back when it drifts. And all of these formal practices are led by the facilitator. There's yoga-based movement, mindful breathing. In this picture, you can see people at UC Irvine doing what's called mindful walking, and that's really bringing your full attention to everything happening in the body and the feet as you're walking and what's going on around you. And these kind of lend themselves to also informal practices, and there's not a complete division as I laid it out here. Mindful eating could actually be a formal practice and is often done is always done in an MBSR class. But once one begins to practice mindfulness, I think that you begin to be aware that often we've left the present moment, and maybe I might be eating on automatic pilot, not tasting my food, not noticing. Maybe I'm on my laptop while I'm eating, and start to realize like, oh, the exercise we did in class actually lends itself to how do I just eat on a regular basis? How can I eat more mindfully? When we're driving, I mean, this is a place of huge distractions, and how can we bring our full attention to driving or mindful working? I think, once you really get into mindfulness, you start to realize that it's really about every moment of your life, that you can either be fully awake and alive for that moment, or you can be checked out, which we often are, myself included. This is one of my favorite images that describes mindfulness. I don't know who made it. I wish I could. I've tried to find the illustrator, the artist who made this, but I just think it really does a great job of showing what mindfulness is. Full disclosure, though, the original picture did have a dog on the right-hand side, but I changed it to a person because I do think that as people, we have a choice of either living with our minds full, as the person is doing on the left, or being mindful, as the person is doing on the right. And what I see here are, two people maybe headed, walking toward perhaps a park with, 4 trees and the sun. And the person on the left is kind of missing it, because what is in their awareness is maybe all of the things that they need to do, and the errands they need to run, and the laundry, and how they're feeling, and, all of these things. Whereas the person on the right is seeing the 4 trees and the sun, probably hearing the birds and the wind and feeling the sun on their skin. And the person on the left is an automatic pilot, missing it. And this has huge effects on us when we're operating in one or the other. And, you might want to, for a moment, ask yourself, where do you typically operate? And, do you feel like you move back and forth between these places? Another, question I ask myself is, how does being in one state versus another affect how safe that we are? I believe that the person on the left is probably feeling much more stressed, and seems much more distracted, and I would imagine probably has a higher chance of perhaps getting injured. That's my hypothesis. A bit more about mindfulness-based stress reduction. It's now offered worldwide. Well, it started in the 70s. It's offered worldwide. More than 20,000 people have completed University of Massachusetts MBSR program. But in addition, many people have completed their professional training to become MBSR teachers. And it's offered all over the place now. And there are many workplace applications too. Mindfulness is being embraced by various workplaces. These are just a few. Let's see. Here we've got at upper right, the Seattle Seahawks have been practicing it, and many other athletic teams too. One of the players was quoted as saying, "Meditation is as important as lifting weights and being out here on the field for practice. It's about quieting your mind and getting into certain states where everything outside of you doesn't matter in that moment. And Search Inside Yourself is actually a program offered by Google. They have an institute and they offer many programs to their employees. In the bottom right, this is a police department in Oregon that has been practicing mindfulness. And it's also in the bottom left, it's really moving into healthcare, and there's a lot of benefits people are reporting there. Perhaps some of you saw this Time magazine a few years ago. It's entitled The Mindful Revolution, The Science of Finding Focus in a Stressed Out Multitasking Culture. And I like that they talk about the science, because I think a lot of times when people hear about mindfulness, they don't think of it as having the science behind it. And it really, I mean, it's in its infancy, but there's a lot of science happening around this topic. So here's just a sample of some of the mindfulness research centers. Here's a chart showing, demonstrating how the research is increasing exponentially over the past 30 years. And I just want to really share a very broad overview of what some of the research is finding. Essentially, it's finding that it often helps physical health by reducing stress. It can help with chronic pain, with headaches, with high blood pressure, with cholesterol, and it can improve our immune function and improve sleep. There's also many mental health benefits being reported, that it reduces anxiety, depression, substance use. I know at University of Washington, they're doing research on a program about with substance use and using mindfulness to help relapse prevention. It helps with obsessive compulsive disorder, eating disorders, emotion regulation. And it doesn't only help people who have a diagnosis. There's also research now just being done in the workplace populations and people reporting that it reduces stress, improves immune response, sleep, and overall well-being. So that's just a really broad brush. And, sometimes people ask, well, how long, how much mindfulness do you need? How often do you need to practice? And I actually sort of think of it as akin to exercise. I mean, we know exercise is good for us. I mean, and probably, in general, the more that we're able to integrate that into our daily life, the better. But I did want to share this study that just 5 days of either mindfulness versus relaxation training, that there was, for those in the mindfulness program, there was an increase in vigor and immune response, and a decrease in anxiety, depression, anger, fatigue, and even in cortisol levels. So, and these 5 days, people practiced for 20 minutes a day, either mindfulness or relaxation training. And so the significant results were found in the mindfulness group. One of my favorite studies is out of Harvard, and they are actually have developed an app called Track Your Happiness. And you can sign up for it, and they kind of ping you at various times of the day. They ask 3 questions. One is, what are you doing right now? The second is, how happy are you on a scale? And the third is, are you focused on your task at hand, or has your mind wandered? And if it's wandered, is it gone to a place that's pleasant, unpleasant, or neutral? And what they're finding is that almost 50% of the time, people are reporting that their minds are wandering. And, often when they wander, they actually go to unpleasant places. So places of stress, which is not only affecting the content of what's in the mind, that has an effect on the body and what is happening in the body, and over long periods of time can even begin to affect one's health. One of the most interesting parts of the study to me is that even when people talked about with all of this data that they're collecting, they looked at, well, what about people whose thoughts are going to pleasant places? And one thing that they have found is when you put all this data together, that actually those who are focused on their task at hand report highest levels of happiness, even when that task is boring, like driving in traffic or doing the dishes. People rate their happiness level highest. And there's a great TED Talk on this. I encourage you to watch it if you haven't seen it. But I think the researcher says something like, if mind wandering were a slot machine, you would never want to play, because wherever your mind goes off to, if you're happiest in the moment, then, why not stay here? And that's really what mindfulness training helps us learn how to do, is build that ability to be in this moment. There's a lot of also neuroscience, brain research happening around here, around this topic of mindfulness. This one is another study at Harvard where people participating in an 8-week mindfulness program demonstrated changes in the structure of the brain. So measurable changes in brain regions associated with memory, sense of self, empathy, and stress. So it's not only that people are reporting, I feel better, right? It's also their brain is different after taking a mindfulness class in ways that correlate with the benefits that they say that they're experiencing. Another study showed that the hippocampus had changed, that people's it develops the hippocampus, which is our emotion regulator. And many people in mindfulness classes talk about, how maybe they are still angry with their kids, but they're not screaming at them, that they're able to kind of regulate their emotions and have a healthier response with their anger. Performance. There was recently, or a few years back, a study done at UC Santa Barbara where students were randomly assigned into either mindfulness training or a nutrition class. And it was I think it was 10 days of training in both of those areas. Or 8 days actually, sorry. And those who were in the mindfulness class showed significant improvement on the GRE in terms of their working memory and reduced mind wandering. They had better performance on the GRE in their reading comprehension. And this also there's research being done on job performance. There's millions of dollars right now going into the military to research how mindfulness impacts the work being done there. There's something called mind fitness training, and they're finding that stress degrades our performance, and mindfulness training builds resistance to stressors of military deployment. And there's also research happening on looking at mindfulness reducing PTSD when people return home. There's not been a lot of research around mindfulness and safety. There were some studies done a while ago around driving. And I know distracted driving has become a big term and is a huge problem, especially with our phones. So this research found that mindfulness may improve driving performance by increasing environmental awareness, blocking distractions, helping to quickly identify hazards, and also younger adults who scored lower in mindfulness, they texted more. So this has led into, that we have wanted to do research on the topic of safety and mindfulness and what's happening around these areas. I did want to mention some big supporters of this. One is my boss here at UC Irvine Environmental Health and Safety. He's the Assistant Vice Chancellor for EH&S and Risk Services. His name's Mark Gomez. And he's really the one that years ago, when I mentioned that mindfulness I felt like would be a solution to, these statistics showing that distraction is a huge problem. I mean, from the get-go, he's been a supporter of us investigating this and building training around it. Also, in order to conduct research, I knew that, I have my doctorate in psychology, but it's not a Ph.D., it's a PsyD, it's a clinical degree, applying the research. And I knew that I needed to work closely with people who were very experienced with conducting research. And I joined forces with UCI's Susan Samueli Center for Integrative Medicine. And John Longhurst, the director, really took me under his wing and invited me to all the lab meetings and has been very helpful in this research. So essentially, the hypothesis here is that, that mindfulness improves attention, and improved attention will hopefully reduce injuries and errors. So in terms of the program, it's largely based on John Kabat-Zinn's MBSR program, slight adaptations to kind of infuse some safety messages throughout. And we've actually been working with different formats. For the research portion of this, we really needed to stick with this model that's been used, this 8 weeks, 2 hours a meeting in person, 2 hours a meeting, having the 6-hour retreat. That's what the research has been based on, so we wanted to start with that. We did do a pilot, which I'll get into in a bit, with the environmental health and safety staff and facilities management staff. And for that group, we did an abbreviated version. So we cut it down to 12 hours. So there were 10 weekly 1-hour sessions and a 3-hour silent retreat. And we're also in process of developing an online program, which has a very different format, which hasn't been researched, but perhaps sometime in the future, where we're offering 10-minute weekly sessions over 1 year. So just a little bit on the informal pilot and this abbreviated format. We just had approximately 30 participants. There was no active control group, so no one got randomly assigned to another group. Everyone was in the mindfulness class. It was optional. They chose to be there. And the findings were that it improved their attention on measures of attention and reduced stress. And we got feedback on the program that we integrated for our larger study, the more formal pilot. And that is basically, we identified that the best work we could do would be with nurses at UC Irvine Medical Center, because nurses, they're a large population. I'm sure I think we have some nurses on the line. They're a large population, and there's, this is tough work, and there's high injuries and errors in the nursing population. I wanted to make it so that this was kind of a part of their work, that it was offered on the job, but we couldn't do that. So it was their own time, but they were compensated with up to 22 continuing education units. So they had to opt into the program, choose to take it and be there. It was a big commitment. It did affect our numbers. We were hoping to have 100 participants, and we had more. We ended up with 50. We have more, but there's attrition always with research. So unfortunately, the numbers are lower than we would hope. We did have random assignments. So for those who did enroll, they were either randomly assigned into the experimental mindfulness program or into an active control, which was a health education program. And throughout the literature, mindfulness, when it's compared to something, it's often compared to health education as sort of just a comparison group. If my research continues in this area, or if others end up doing research in this area, I think it would be better in this case to have the active control be a safety class. That's really what my question is how does mindfulness compare to sort of the traditional safety classes? But the hard part here was you can't really randomly assign people to their safety classes. They're required to take them. So perhaps there could be some protocol developed of maybe safety information that's not necessarily required, but I actually think that would be the best comparison group in this case. So, there were a variety of techniques taught. Many of the nurses talked about, and I'm just focused right now on the mindfulness program, but talked about using mindfulness before they administered medications. So, given, as I mentioned earlier, that medical errors are the third leading cause of death in our country. If you were in the hospital or you had a loved one in the hospital and this nurse was coming to put medication into your body, I would imagine that we would all hope that she was fully present and fully in the moment and really, knew what she was doing. And I believe that knowing mindfulness is a wonderful way to teach people how to do that. We also even talked about mindful hand washing. Infection control is a huge issue in hospitals. And I've seen some studies saying, I used to wonder, are people not washing their hands? And some of the studies I've seen talk about actually people are washing their hands, but maybe not properly. And I think applying mindfulness to the very act of just washing your hands, where it's not just an automatic pilot, quick hand washing. It's really feeling the water and feeling the soap and knowing and washing with intention. So if you are intently washing your hands with the ultimate goal of getting the germs off your hand and of caring for your patients and caring for yourself and your community, then washing hands suddenly begins to look very different. And also feel different. And the nurses actually talked a lot about this hand washing experience and how it became a time to sort of center themselves in the middle of their very kind of busy days. They would really kind of just go and spend time at the sink and ground themselves. So a little bit, we do not have all of the results yet from this study. We do have some of the survey results, and what we found. So these are the surveys that we used: a mindfulness scale, a stress scale, a work engagement scale, and a burnout scale. And where we found improvement was we found that there was significant improvement in mindfulness scale in both the mindfulness and the health ed, both pre to post. So from the start of the class to the end of the class. The stress scale, actually, there was significant improvement only in the mindfulness class. So significant reduction in stress. And that one also had a subscale called emotional exhaustion. And there was significant improvement in the mindfulness class, pre to post. So those are the survey results. Another, the survey is subjective, so people are writing their responses down, but we also did want to have an objective measure of attention. And so Michael Posner is known as kind of the father of attention research, and he developed a computerized attention test called the ANT, the Attention Network Test. And so with every nurse that went through our study, we met with them pre and post individually to do their attention test. And what we did find is that the nurses had significant improvement in their executive attention from pre to post. The executive basically is like our decision making. So on this attention network test, they had to make decisions about stimuli that were in front of them. And so it was the mindfulness class had significant improvement in their executive attention, which coincides with other studies on mindfulness and attention. So we've also had to have much time elapse in order, you can't, at the end of the study, you can't just measure injuries because you have to allow time to pass and allow there to be a space that people may or may not get injured. So what we've done now is we have recently gathered all of the data about the work-related injuries and errors and sick days and job retention and organizational costs. And our next steps are to analyze this data and see if there was any impact. Again, I'm not, that was a smaller sample size than we wanted, so I'm not sure what we're going to find, but I look forward to having those results. And a little bit too on participant feedback. I thought I'd read a few kind of quotes on this. With my department, my environmental health and safety department, someone said, for me, the practical application is how I respond to work things. Typically, when I get an email, I want to respond right away. Now I check in with myself about my goals and I ask myself if this is urgent. I now have the awareness to focus on what I need to get done. I'm not at the beck and call of everyone's request. And then 2 quotes from the nurses. One is, it helps me to focus. I work in the ICU and I have a lot of stressful situations. It helps me to do the breathing and calm down. And with the hand-washing meditation, it helps me to take a few breaths, calm down, reprioritize, and keep calm in upsetting situations. My adrenaline doesn't get as high as it has in the past, so I can think, what's the next move? And another nurse said, my experience was excellent. It was worth it. It makes me slow things down and take time for myself. If I don't, I can't be there to take care of others. I wish everyone could have this chance. It totally makes a difference. I even take a few deep breaths before I administer medication to a patient. I believe this will cut down on medical errors. So just to recap what we are examining, we are in the process and in the middle of examining whether mindfulness reduces workplace injuries and reduces workplace errors. What we do know, a recap, is that research supports that mindfulness improves many aspects of physical health, emotional health, overall well-being. It improves attention, especially executive attention, performance, and that these are not just things that subjective things, that this is also, we are seeing changes in the body and in the brain that correlate with all of these findings. So, given all of the benefits associated with mindfulness that we already know, it does seem like a relatively low cost with potential for very high return on investment. Most mindfulness classes, this is just really a ballpark. I think the in-person MBSR ones may be somewhere around $300 per person. It depends on the location, and some might be higher or lower. There are also online mindfulness programs and I think those can be offered at a reduced cost, although there are missing components to that. I think that with the MBSR in person, that those can be, there's so much value in the social support that's developed in the classroom setting. But our center we are in process of developing an online training. I don't see it as the end all, but perhaps a bridge maybe it can support people who already practice mindfulness. And then it can also be a bridge for those who have never been exposed to it before. It can, just kind of skim the surface, and after going through this, perhaps they might want to delve deeper and join the in-person kind of longer types of experiences. So with that, I will turn it back to Julia to share if there are any questions that came up or comments.
Well, thank you so much Jessica, for that really wonderful presentation. It's so interesting. And I just want to remind everyone, please do use the Q&A if you have any comments or questions. We do have one question to begin with, Jessica, which I'll read to you, which says, "Thank you for sharing research on mindfulness. As I'm currently working on my dissertation on the topic of mindfulness, what would you recommend to do in applying mindfulness to student programming as our work trickles down to helping not only employees but our university community?"
Wow, that's a great question. And I love that you're doing research on this, and I wish you the best with your dissertation. And absolutely, you know, I think it's wonderful to be able to bring this to the students, and such a huge need there. So can you read that one more time, Julia? Was there a specific question about kind of bringing it to the students?
Yes, there's what would you recommend to do in applying mindfulness to student programming?
Right. I mean, it's a great question. I wish we could have a conversation, and feel free to find me on my website and give me a call, and we can discuss this further so I can see, you know, what your original ideas are. I am actually teaching mindfulness, I mentioned earlier, but I think it's so important that we bring it to the youth, and in some ways, ideally, that it almost be part of curriculum. I know if you're working at the college level, you know, that might be a harder thing to do. But there are some schools, like for younger kids, where it is becoming a part of what these kids are taught. And I mean, there's a program in Oakland called Mindful Schools. And if you haven't been there, I encourage you to go to their website. So they're a nonprofit in Oakland, and they teach people how to teach mindfulness to students. They do a lot of online training. They have in-person events too. And I was trained by them to bring this to youth. And, you know, kids eat it up. I think that the reason that they do is because it helps them. And my experience is that, you know, in our culture, I think a lot of times people end up in a mindfulness class because they're suffering in some way. Maybe a doctor referred them for a health reason, or a psychologist that might be struggling emotionally, having that full catastrophe that we will all face if we haven't yet. Why do we wait until we're suffering to learn these skills? I don't know. And so I think bringing, like, maybe a focus is how do you really get this out to as many people as possible? At least give them the option to learn it. Let them know it's available.
Actually, we have a comment from Kelly Shed, who says at UCLA they teach a Bruin Mind Fit course for students, which is a mindful course open to all students. And she's happy to answer questions about that program. And she shared her email, kshed@recreation.ucla.edu, which we can provide to anyone who would like that. But to our next question, Marlene asked, what was the name of the happiness app?
Oh, I think it's called Track Your Happiness.
Track Your Happiness.
Track Your Happiness.
Another question was, in the study that you did, what was the survey outcome regarding work engagement?
We did not find significant results for either group for work engagement or burnout.
Do you have a mailing list or listserv to help keep us abreast of any new developments in safety and mindfulness?
Yes, actually, I have a website, and maybe the best thing would be for me to send this to you, Julia, and then if you have follow-up with this group, you can send them to my website, where you can actually, like, log on, and you can be on my listserv.
Oh, that's wonderful. Thank you. Another interesting question is, from somebody, is there people who should be careful with mindfulness? For example, someone with a mental health or mental illness, such particularly bipolar or schizophrenia.
Right. And can you say that again? Is there a question around should people be careful?
Yes. I mean, it sounds like, is it appropriate, I guess, for
right.
using mindfulness?
That's a great question. And I'm glad that you put it in there. So thank you. Because I do sometimes get on my bandwagon and talk about how it's a cure for everything and it's so wonderful. But I think that, if someone does have like a mental illness, that they should be doing this under, in conjunction with a doctor and with their mental health provider. Because I think it can trigger things for people. Another area in terms of mental health where it might not be the solution is actually for PTSD. I mentioned that it's being looked at in the military to reduce PTSD, and I believe that there's some initial findings that it can reduce it, but I believe it's not considered the best treatment for PTSD. So that's an area it's a great question and something that we should be aware of.
I was wondering if, you mentioned there was a 5-day study that showed mindfulness reduced anger, and I wondered if there was any research looking at its application in reducing workplace bullying or aggression at work.
If there is, I haven't looked at that. So I mean, that's an interesting question, and I would imagine there's so much happening on this topic right now that I wouldn't be surprised, but I haven't seen it. I haven't personally looked into that.
We're getting lots of people saying thank you so much for this presentation. And as a nurse myself, I particularly love the idea of the hand-washing meditation. And it's such a good idea to use something that people have to do anyway to turn it into an opportunity for mindfulness meditation. I think is so impressive. It's a great idea.
Oh, thank you. One thing on that, if I have a minute, in teaching I mentioned I teach elementary school kids, and I remember the first time I taught the hand washing meditation to a class of preschoolers, and I started by asking them, why do we get sick? And they understood, some of them, like, oh, we have germs and how we can't see them, but they're on us, and how hand washing is how we take care of that. And we went through this hand washing meditation, and at the end of the lesson, the whole class stood up and came over and hugged me.
Oh.
And I was not saying group hug everyone. But I felt from them that they were 4 and 5-year-olds, and I felt like they had this experience where they were like, thank you for this information. Like, thank you for teaching me to, we also talk about how as we wash our hands, we say out loud or to ourselves, I am taking care of myself and I am taking care of my community, while we're washing our hands. I think often kids are taught to say the ABCs while they hand wash, and that's helpful in lengthening the time, but I think mindfulness deepens the intent of why we're doing this.
Well, I have to say that was a beautiful note to end on, and thank you very, very much for your time today and for sharing your really important work with all of us. And we wish you every success in the future and look forward to hearing more from your research as you continue. Thank you very much again. And just to let everyone know who's still on the call, that next month on Wednesday, November 1st, we have Rich Meyer from Nevada, who's going to present on the process safety pyramid for us. So please join us again, and thank you to everyone, and thank you to our speaker today.
Thank you for having me. It's been a pleasure, and I appreciate everyone's presence here today.
And I just wanted to say to everyone that we can share your website and your contact information when we send out the evaluation for this webinar. Is that okay?
Absolutely. And also thanks to the people on the chat saying group hug. I like that ending.
Oh, one more last question is we have someone asking, can you send us the hand washing meditation practice? Is that
sure? It's written out as a Word document, and I'm happy to share that.
Okay, well, we'll send that out with the eval too. And thank you again. Goodbye.
Thank you.